You can usually tell how much somebody knows about a topic by how many tests they recommend or how many tests they order. You guys send me a lot of videos on my various social media profiles where this one person who is obviously generally not a cardiologist, is not a subject matter expert. He's like, when patients come to me, I order a full metabolic panel. And this metabolic panel includes everything from like homocysteine to CRP, to oxidized LDL, to particle counts and small LDL versus large LDL versus fluffy LDL versus like all these tests, a urine stress oxidative test and an MTHFR and all this nonsense. And then you ask an actual expert, like, the president of the European Atherosclerotic Society, Dr. Thomas Dayspring, myself, all these people that have endorsed my book, and you're like, hey, how does a young person really know their risk of heart disease? Without ordering $4,000 worth of tests, they're generally not covered. They also recommend like calcium scores and like, all this other stuff, artery something tests. I mean, they put a whole bunch of stuff on there. These are usually the chiropractic type physicians or these wellness providers that really have no idea what they're doing, or they're like a metabolic health coach or some former doctor turned metabolic health coach that wants to order $4,000 worth of nonsense on you. So how do you know what your cardiac risk is? If you're a young, healthy person, I've talked about this all the time. If you want to know just your cardiac risk, all you need is an apolipoprotein B, which I'm pointing to the, apolipoprotein B, LDL particle here in the background. You need an apolipoprotein B and you need a lipoprotein A. And that's literally it. If we know that starting at a very young age, we know how aggressive we need to be with your cardiac risk. The higher those are for the longer, the more likely you are to have a heart attack or stroke. This is not debatable in the literature. There are very few things in science where we can say, yeah, this is it. We know this is true. Absolutely, this is one of them. If you have apolipoprotein B that is elevated or lipoprotein A that is elevated, you have heart disease. Now, same thing goes kind of for like when somebody comes to see me as a cardiologist. A person comes to me, like, for example, let's just take a primary physician or like your primary provider, whether it's a nurse practitioner, PA, primary doctor, whatever it might be, versus a cardiologist. You go and see the primary provider and you're like, doc, I have chest pain, I'm lightheaded, I'm dizzy, I think I have dysautonomia or POTS syndrome or whatever. And they may go and order a ton of tests because they don't know. They think something will stick. You go see the world's greatest dysautonomia, POTS syndrome physician, and he's like, I don't need any tests. I heard everything I need to hear. Here's what you have. Here's what we need to do. This is something that is pretty well known in medicine. The more experienced you are and the more you know, the less amount of testing you need to make the diagnosis and figure out what this person has or what this person doesn't have. So this is quite common in medicine. So as a young person, if you want to know your risk for heart disease, there's a few tests that I would recommend. Just to know your risk of heart disease, let's say you're 18, 15, 20 years old, 30, whatever, kind of young, never really had any issues, something runs in your family, but you're not sure what it is. The best tests you need to know your risk of heart disease, plus I'll add a few more that I think are essential for anybody. You need an apolipoprotein B and a lipoprotein A to begin with. That tells us everything we need to know about your risk. We will ultimately need a fasting triglycerides just to know if you have like hypertriglyceridemia or any one of these other genetic triglyceride issues, because those do need to be treated aggressively and or differently. If your triglycerides are over about 400 or 500, we know you have more serious problems and we need to treat those differently. Now, what do you need for your general life screening as a person? Do you really need to go to get a carotid intimal media thickening test, a CIMT, and an echogram, and a stress test, and a calcium score, and a CT angiogram, and a Clearly scan, and all these tests that people recommend as a screening tool? You generally do not need those, but you do need some basic annual blood markers almost every year. This would be like a CBC to figure out what your red blood cell counts are, your white counts, your hemoglobin, your hematocrit. You will need a CMP or a complete metabolic panel. This tells us like your sodium, your electrolytes, your liver panel, how well your liver is functioning or not, your kidney function, etc. Those kind of things are very helpful. You'll need a thyroid, like a TSH and possibly a T3 to find out if you have thyroid disease. Men will need a PSA to figure out if they have possible prostate cancer. You'll need a testosterone level to find out maybe why you're fatigued, why you're not feeling right, all those kind of things. And obviously whatever the equivalents are in women who are going through menopause or think they might be going through menopause. Those are kind of mainly the tests you need. And any any doctor can order these for you and they can easily be covered. Oh, you'll need a hemoglobin A1C as well. I always forget to add that one because technically you get a fasting glucose in your CMP, and A1C just gives us more of like a 2 to 3 month average, depending on the assay they use. Those are kind of all you need to figure out what your overall kind of health in general is. Now, if you're having chest pain type symptoms or you're out of breath or, what have you, then we could do an echogram and a stress test and wear a heart monitor if needed. But in general, these are the tests you need. Maybe I'll put them up here. You do not need the homocysteine and the CRP and the, all this other nonsense that a underexperienced or lack of experience or grifter type physician would order for you. I hope this helps. I'm Dr. Al. I'm a board certified cardiologist, been teaching cardiology for a long time. Join my community if you like this kind of stuff. We talk about this every day. We go live once a week privately in the community, and you get access to all the previous lives, and you can talk and text me every single day in the Dr. Allo app.